everyone, welcome back to my channel. My name's Krista. I'm an international mama of two, dental hygienist turned midwifery student, and here on my channel I'm going to be talking about all things motherhood, midwifery, pregnancy, and childbirth education. So if you're ready to do it, let's go! Hey everyone, welcome back to my channel. This is week 2 for Birth and Bloom, and I'm really excited to be here today and talk to you a little bit about the glorious cervix. So week 2 video is all about the cervix. What is the cervix? Why should you care? What do you need to know, especially when you're pregnant? You hear a lot about the cervix. So in this video, I plan on making things a little bit more clear, helping you understand what is the cervix, why is it important, what does it do in pregnancy and labor and birth, and just some of the basics that I think are going to be very helpful for you. So I want to start this video by saying I really think it's important for everyone to have some basic understanding of our human anatomy. Our bodies are incredible, beautiful machines, and I think we owe it to ourselves to have some basic body literacy of what our body parts are, what they're designed to do, what's normal, what's not normal. So in this video, like I said, we're going to be talking all about the magical, mystical cervix. So let's go, let's get into it. So I have a little bit of some visual aids today. And I first want to show you what the cervix looks like in a non-pregnant person. I hope you can see this. So here, we'll start up here. So here is our lovely, beautiful reproductive system in the female, the body of the uterus, the vagina, and here is the cervix. That's what we're going to be talking about mostly today. So as you can see, the vagina leads to the cervix, which the cervix is the lower portion of the uterus, the body of the uterus. So it's this little section here. And here's another diagram from the side view. So here you can see the birth canal, whoop, and it leads us to the cervix. So this is obviously a non-pregnant uterus. It's kind of closed in, it tilts forward. The cervix kind of points back, it's more posterior. So if you were due for your normal annual exam, many of us ladies, we know the fun. You go in for your annual exam, you may or may not be due for a pap smear, but what a pap smear does is check out the cervix. It takes a little sample, a little swab of the cervical cells, and gets sent to the lab and helps the practitioner and you learn if there's any abnormalities, if there's any abnormal cells that could potentially lead down the road to cervical cancer, something like that. So when you go in for your annual exam, if you're due for a pap smear, they put this speculum inside your vagina. They open up a little bit to get a clearer view. TMI, but it's just what happens. And then they get a nice, beautiful view of the cervix. So in a non-pregnant person, your cervix is about 25 millimeters, so 2.5 to 3 centimeters thick. So when they're looking inside, they're going to be looking at the external os. So the external os in the cervix itself is nice and closed. It's going to look like a little donut, if you will. So the external os is where they're going to take a little swab of the tissue here, send it to the lab, hopefully have a good report, no issues, and kind of go from there. So that's what you need to know as far as the basics there. So also in non-pregnant women, your cervix is pretty much closed most of the time. When you're on your period, the little bit of cramping that you may be feeling is causing a little bit of dilation, really. So it's starting to open up the os, which is the hole in the cervix. It opens just a little bit to allow the blood to kind of flow outward. Aside from your menstrual period, it really should be remaining nice and closed throughout your menstrual cycle. Okay, so that's how it is with just your average person. So let's talk about what happens in pregnancy. Sorry, it's hot and sweaty in here. Okay, we're back. So let's talk about the cervix when you're pregnant. So many people will hear all about the importance of the cervix in labor, the importance of the cervix for birth in general, but let's talk about why it's so important in pregnancy and birth, and a little bit of the basics of what you need to know. So like I said, when we're pregnant and through most of our pregnancy, it's gonna be nice and thick, okay? Nice and thick. And you can think of the cervix essentially as like the gateway between the vagina and the uterus. We want that to be nice and thick and closed throughout the pregnancy. Why? Well, it's important to know that we want the cervix to be nice and thick to keep baby inside and to prevent things from getting up inside of the vagina and through the cervix and to potentially cause any issues, infections that we want to avoid. So the cervix is beautifully designed. Like I said, there's an internal and external os. That's the little opening. The internal os is towards the uterus. The external os is what you would see if you were to do an exam with the speculum. So during pregnancy, our bodies are freaking amazing. Our bodies know that we want to keep the baby beautiful and healthy and growing and safe inside of us. So what does it do? Inside the cervix, inside of that os, it builds up a nice, thick mucus. So you may hear a mucus plug. That mucus forms inside of your cervix and essentially acts as a cork. This is incredible because it's being nice and sealed and closed. That's gonna be preventing any negative, bad pathogens, bacteria, viruses, yeast from going up into the uterus and affecting the pregnancy and the health of your baby. So it's really important and absolutely miraculous that the cervix forms this mucus plug. So that's amazing. And we'll talk a little bit more about the mucus plug as I go on and talk to you about the importance of what happens with the dilation, etc. So the mucus plug, amazing. We want it. You may notice a lot of fun mucus discharge coming out of you throughout various stages of pregnancy. This is all normal. Some people even lose smaller pieces of the mucus plug throughout the pregnancy. That can be normal. Be aware that especially as a first-time mom, you're probably gonna look at the toilet, look at your toilet paper, and really figure out what the heck's coming out of you, and that's very normal. I know in my first pregnancy, I was like hyper attuned to everything. All the fluids, all the liquids, all the very, very fun things and glorious parts of pregnancy. But just know that most of the time, these things are normal. I'm gonna be talking about vaguely, in general terms of nice, normal, healthy pregnancies and cervixes, etc. There, of course, are things that can happen. An incompetent cervix, other complications that I'm not going to go into with you right now. Save that for your doctor, save that for your midwife. Here, I'm just doing the basic education of what the cervix is and why you should care. Okay, so we covered that. So let's talk about the end of your pregnancy. At the end of your pregnancy, it really depends on who you're seeing as your care provider, your practitioner. Generally, hospital-based practitioners, obstetricians, or certified nurse midwives, they may be recommending to do cervical checks at the end of your pregnancy. 37, 38, 39, etc. Okay, and then inversely, in the midwifery model of care, they may not be doing any cervical checks at all until you're in labor. So what I want to say about that, it's gonna vary from person to person of what you want. It's gonna vary from practitioner to practitioner of why they wanna do these things and how you feel comfortable. So essentially, later in pregnancy, what a practitioner would be looking for and why they might recommend or suggest doing a cervical check, say, let's give the example of 38 weeks. They may want to see what's happening with the cervix. Is it starting to get a little bit soft? Are you starting to have a little bit of dilation? So the reason why this matters is that as we are approaching the end of our pregnancy, our cervix goes from being about as firm as the tip of your nose to, once you're in labor, once things are moving, as soft as your cheek. So towards the end of your pregnancy, definitely by labor, your cervix is going to become more supple, it's it's gonna be softer, it's going to be more favorable to cervical effacement and dilation. So let me pause on the cervical exam conversation for just a brief moment, and let's talk about what is cervical effacement and what is cervical dilation, and what's the difference, why does it matter, why are they both super important. So cervical effacement is the thinning out of the cervix. So let's pull this back up here. Let's see if you can see. So this is a pregnant mama, obviously, baby inside. Here, once again, is the cervix. So like I said, the cervix is our gateway, is our what's keeping baby in and what's gonna allow baby to come out. So the cervix here is gonna need to become soft and malleable in order to do what it needs to do for it to efface and open and allow baby the space they need to come through. So effacement is thinning. So essentially look at our normal cervix, it's thick, it's firm. As labor is growing near and as your body is preparing, you're gonna start to have a more supple cervix. Like I said, it's gonna get softer, it's gonna start to thin out. So it's gonna thin, thin, thin. So you may hear, if you're getting a cervical check prior to the onset of labor, if you're gonna get a cervical check, for example, 38, 39, 40 weeks, whatever, your provider may say, okay, you're 50% effaced and you're 1 centimeter dilated. Okay, what does that mean? So essentially, the cervix has softened, yes, and thinned 50% of the way. The cervix is gonna need to thin 100%. So essentially, it's important to know, okay, let's just do a little splat. The cervix is gonna have to get paper thin. It's gonna get so thin, okay, it's not gonna splat out like this, but it's gonna go from a thicker piece of tissue, and it's gonna thin, 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 thin. So it's gonna go from your 0% effaced to, 60, 70, 80, 90, 100% effaced. So when you're completely effaced, the cervix has completely thinned out to as thin as it's possibly gonna get. From there, it makes sense that if something is thin and malleable and nice and stretchy, it's going to better open. And that's what's really important. And it's a very common thing you hear about when you're in labor is you focus heavily on dilation, dilation, dilation. Yes, dilation is extremely important, but the cervical effacement or the thinning is equally as important to the whole picture. So the thinning is what's gonna allow it to be even more malleable and soft, and then allow for that opening. So like we said, dilation is just that. It's the opening of the cervix. So this is a lovely visual aid, and it's just beautiful. Hence Birth and Bloom, I love flowers. But this is an amazing visual aid of showing how tiny or how little the cervix is open. This is 1 centimeter. All the way 6, 7, 8, 9, 10 centimeters. So that is a big way to open. That it has to open very far. And I know that this is, you look at this and you think, holy cow, how is my body gonna do that? How is my baby gonna get out of me? And it's incredible. The design of birth is amazing. The more you learn about birth and the more you understand our bodies, you're like in complete awe that this is your body's natural design and birth is designed to work. Like I said, of course there are anomalies. Of course things can happen to prevent your body from going into labor naturally or many other things. But in general terms, your body is designed to give birth. Your body is designed to grow babies and birth babies and breastfeed babies and then do it again. So anyway, with this beautiful visual aid, it's showing dilation from essentially closed all the way through 10 centimeters. Perfect little baby doll from my daughters. But it goes to show you, boop. So 10 centimeters of dilation is gonna allow the baby's head to slip through, rotate, and be okay, it's not really meant to go through here. You know what I'm getting at. The baby's gonna slip through through and be born. That was a little bit of a shoulder dystocia. We'll talk about that at another time. So this is all about the dilation. So together, effacement and dilation are so important, and that is what is allowing your body to make the space necessary for the baby in 94 to 97% of the time for the baby's head to make way and travel past the cervix and through the vagina to be born. Amazing. One other thing I want to say about the cervix. So we know it's effacing and it's dilating. What happens to that tissue? It doesn't just magically disappear. Well, what happens is it's thinning, and as it's thinning out, essentially the top of the uterus, which is called the fundus, gets really nice and thick. The bottom lower segment of the uterus is really thin, but the muscles as you go to the top of the uterus are nice and thick. This is freaking amazing, guys. Why? Because your uterus is designed to act as like a piston. It's designed to push baby out. So by the cervix making way and thinning out and getting out of the way, the muscle fibers on the top of the uterus are getting nice and thick, and that literally is creating a piston to push baby down and out. When I learned that, my mind was blown. It's incredible. In theory, if you have an undisrupted birth where you're not having medical interventions and medications, you can experience something called the fetal ejection reflex, which I did in my second birth, where your uterus is doing the pushing for you. All of a sudden, there's this massive urge where your body inside is literally pushing your baby down and out. And it's the most unbelievable sensation and experience that really I've ever had. I didn't personally know I was about to give birth until my body was literally pushing for me. And then I was like, oh, wow, I'm actually about to have a baby. Like, this is insane. So a couple pushes later, my second daughter was out. So those are the basics, effacement and dilation. And I do want to briefly touch on the station of your baby. So imagine baby's inside, la la la, happy, happy, happy. But they're kind of floating above the inlet of your pelvis. They're not really deeply engaged yet. So the station is telling us where the baby is in the pelvis. When the baby is really deep in the pelvis, that is what we want. That is when most women are gonna feel the urge to push, when they're fully dilated and the baby's head is like right there on their pelvic floor. It's really like making its way down through the pelvis, and that's when women report feeling like the big urge to push, because baby's right there, like baby's ready. They're not up above floating. So the station is important to know as well. Okay, so back to cervical exams and what you should consider. So, like I said, some practitioners are gonna wanna start to kind of, for lack of a better term, meddle early, like while you're still pregnant, and others are more hands-off and are not gonna recommend doing cervical checks until you're actually in labor. So as I said before, if you're deciding, and mind you should always be consenting for a cervical exam or a vaginal exam, internal exam, whatever they wanna call it, you always should be given an opportunity to know what the risks versus benefits are, why your practitioner wants to do this, what information are they gonna gain, and what the benefit is really to you. Do you want hands in there at 37 weeks when labor's likely not close? My opinion would be no. But to each their own, you can make your own informed decisions, and that's totally fine. But don't feel like you have to consent and say, yes, I want a cervical exam from 37 weeks on. So I will say that if you decide to have cervical exams while you're still pregnant, in your later stages of pregnancy, let's say 37 through 42 weeks, if you decide to have cervical exams, know that they're going to be feeling for effacement, if it's nice and firm still, or if it's starting to soften. If it's nice and supple and starting to ripen, you'll hear. And they'll check for effacement and dilation. I want to preface and say that Your cervix is not a crystal ball, as though like we really wish it were, but it is not. I want to give an example of a situation where, say you consent to a cervical exam at 39 weeks, your first time home. They do a check, they say, oh, okay, nice. Your cervix is 50% effaced, meaning it's starting to thin, and you're 2 centimeters dilated. Oh, great. That means that we're starting to have cervical change. Your body is starting to prepare for labor. This is a good thing. But there's a caveat. You know this information, and you may be thinking, oh, my body is starting to change. It's starting to get ready. But guess what? It doesn't tell us when labor is going to start. So if we're waiting for spontaneous natural labor to start, that woman who's 39 weeks could go on to be pregnant for multiple more weeks. She could be pregnant till 41, 42 weeks. Most hospital practitioners are not going to let you go past 41 weeks. And I use let go, like it's your decision. You could absolutely prolong your pregnancy for as long as you want and go into spontaneous labor. Generally, most practitioners want their moms to be delivered by 42 weeks. Needless to say, you could have the anticipation that labor's coming, I'm gonna have my baby soon, and then be starkly disappointed and impatient that your labor doesn't start for potentially weeks. And then, like, I have a friend also, very similar situation where she, with the second baby, was sitting at a dilated like cervix at 5 centimeters. She wasn't in labor. So yes, it was helpful to know that her cervix had already moved and changed that far, but she also, I think, was pregnant for another 2 weeks, and then she still, had a harder, longish labor. So it can tell us some information. They're not all bad, they're not all unnecessary, but you have to just take what you will with this information that you're provided. And also, like, you don't want to feel the pressure that, say you have a vaginal exam at 41 weeks. You want to have a natural spontaneous labor. So, you're starting to hear little words of induction, we need to get this baby out, blah, 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 blah. So say, for example, you're completely closed, you're tight, it's firm, there's no dilation, there's no effacement, like nothing has happened with the cervix. This can be extremely disheartening, and you start to have questions of, is my body going to go into labor? Does it know what to do? And the answer is yes, it knows what to do. It's just not, it's not ready at that exact like snapshot in time. That same woman could go into labor that night. So it just is really like, it's a bigger picture than just a quick snapshot of what your cervix is doing at that exact moment. So I want to touch on, that's before baby, so that's prenatal care. I want to talk about cervical checks in labor. Most of the time, if you're having a hospital birth, a birth center birth, or a home birth, your obstetrician or midwife or the nurse on call or whoever is going to want an idea of what your cervix is doing before they admit you and say, yes, you're in labor, you're going to be here to stay. So most times they will want to do a cervical exam. And in that case, I understand. Like, they don't necessarily want to admit a woman who thinks that she's been having hard labor and may very well be having hard labor, but is only 1 centimeter dilated, because that's a long road. In a hospital setting, you don't want to be admitted super early, because frankly, the longer you're in the hospital, the more of a chance of unnecessary medical interventions that can lead to the cascade of medical interventions. And that's a slippery slope that most people don't want to put themselves into. So if you're having a hospital birth or a birth center birth, it's like if you can labor at home for as long as possible and delay going to where you're giving birth, that generally is the way to go. So feeling like really when it's time, labor, the contractions are getting closer together or getting harder, you can't really talk through them anymore. Generally, they're about a minute long, coming every 4 to 5 minutes, is starting to be the time where it's considered appropriate to go to your birthing location. But even still, if you're having a home birth, generally, midwives will really watch your body language, see how you're coping with labor contractions. They can really tell if you're in early labor, if you're in more active labor, transition, or getting ready to push. But many midwives will still like to have a general idea with doing a cervical exam and seeing where you're at. I want to give my own personal experience For my first baby, if you didn't watch the last video, my first baby, I had her in the hospital setting with a certified nurse midwife. And I started developing gestational hypertension at the end of my pregnancy around 36 weeks. And because of that, by the time I was 37 weeks, I went in for my prenatal visit, and I knew my blood pressure was getting a little wonky. I knew like things were kind of not going in the right direction as far as having the rest of my pregnancy be really healthy and to go into spontaneous labor on my own. So by 37 weeks, the topic of induction came up because my blood pressure was not very stable, and it was in the range where induction was definitely an appropriate road to take. So at 37 weeks, because I knew I was likely going to be having this baby soon, I consented to having a cervical exam. And at that point, it was actually really, for me, a relief to hear, because I think at that point, I had been having some like cramping and contractions, so I felt like my body was starting to do its thing. And I know that I at least was maybe 60% effaced, 2 centimeters dilated. So that gave me a little relief going into my induction, knowing that my body had already started to prime the cervix, was already becoming nice and supple and stretchy. And generally, if someone needs an induction, if your cervix is already starting to get soft and become more favorable, that in general terms would lead to a smoother induction process, because inductions can be really long and hard. And if your body has already done some of the hard work prior, it can make for a smoother process. So for me with my labor induction, it all moved really quick, and thank God. It was a really fast birth and induction for a first-time mom. Generally, like I would say my actual labor was about 5.5 hours, which was fast for a first-time mom. And then for my second baby, I had her in a freestanding birth center. Oh, sorry, I wanted to touch back on that. During my induction, I had quite a few cervical checks. Initially, when I was first in there, I had something called a Foley balloon or catheter, which essentially dilates you to 3 or 4 centimeters. So I think I had one after that. I had one, I think, before I had my water broken. I had all the inductions, guys, I had all the interventions with my induction. I had a Foley balloon, I had Pitocin, I had my water artificially broken, I had an epidural, and in hindsight, my epidural I had done like right before I was about to push, but I enjoyed it for like 40 minutes before I started pushing. Needless to say, I was offered and given multiple cervical exams throughout my labor experience. On the flip side of that, with my second baby, I was given one, which was so chef's kiss, amazing. Because to be honest, guys, it's a fairly invasive examination. Your practitioner is going to insert 2 fingers into your vagina, and they're going to do the best they can to feel your cervix and, feel how dilated you are and how effaced you are. So with my second labor, when I was admitted into the birth center, my midwife did a brief exam. I was 4 to 5 centimeters dilated. I think I was 90% effaced. My bag of waters was bulging, which is a good sign that things were really happening. And that was the only cervical exam I received my entire labor. In hindsight, it was very short labor. I got there, had my cervical exam done, so I kind of knew where I was. My active labor was just starting. 1 hour later, my water broke on its own. And then within like 45 minutes, my baby was born. But I did not have a cervical exam to say I'm ready to push. So many times they'll do a cervical exam and to confirm that you're complete or 10 centimeters. And that's when a practitioner or provider will say, okay, you're ready to push. In a medicalized birth, you may not necessarily be feeling the urge to push, but like I said earlier, with my unmedicated birth, boy, oh boy, woo, it was intense. And I had that fetal ejection reflex where baby was ready. There she is up there. She was ready. My uterus was really pushing down, so it was doing the hard work for me. And I had a couple really conscious pushes with working with my uterus, and boop, baby was born. So I think that covers the basics of what is the cervix, what you need to know about it, why it is important, the changes that need to happen while you're in labor and for your birth, and just be prepared to ask questions. If you don't feel comfortable with all these extra cervical exams leading up to birth and even throughout your labor, you have the right to decline any treatment that is being recommended to you. What I will say, if you're having a hospital birth, be prepared to be offered more cervical exams. And you can always decline. Say, hey, I'm not ready for that right now. I want to let labor progress a little bit longer. And also because they can be discouraging. If someone was in 2 hours prior, you were 3 centimeters, 2 hours later, they're in, oh, you're 3.5 centimeters. Like it's a mind game where we're not necessarily meant to know exactly how our bodies are changing, because for my second birth, for example, I went from 4 or 5 centimeters to complete 10 centimeters within an hour. Really, like probably an hour. So that is crazy. So don't be discouraged if your cervix is not making a lot of change. Give it time, use gravity. Really, if you are considering getting an epidural, that is totally your right, but I would recommend delaying it as long as you can, because work with your body, work with movement, work with gravity, because these are all things that are going to help change your cervix faster and get your baby to you. And that's what we want. This is what it's all about. So I really hope that this video was helpful to you. I hope I covered enough of the basics. If you have any questions, make sure to drop them below and I'll get back to you. It's been so nice chatting with you. Thank you for sticking with me this whole time, and we'll chat in the next one. Bye-bye.